Hi, I'm Sue Telecat from the Bloomberg American Health Initiative. Are you and your organization working to reduce overdoses, end violence, improve food systems, protect the environment, or support adolescents in the United States? If so, you may be eligible for a full scholarship to earn an MPH or DRPH degree at the Johns Hopkins Bloomberg School of Public Health. The Bloomberg Fellowship through the Bloomberg American Health Initiative can help you transform your career, support your organization, and make a significant impact on your community. Find out more at americanhealth.jhu.edu/fellowship.
Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith Rogers. Today, fake drugs from online pharmacies. Dr. Henry Michtalik, an assistant professor of medicine at Johns Hopkins who studies patient safety, works with BESAFE, which stands for Behavioral and Educational Strategies for Avoiding Falsified Medicine Exposure. The initiative is a partnership between the Johns Hopkins Bloomberg School of Public Health and Pfizer and aims to better understand the market of falsified and substandard drugs and how providers can better counsel their patients to avoid them. Let's listen. Dr. Henry Michtalik, thank you so much for joining us on Public Health on Call. Would you tell us a bit about you and your work?
Sure, Lindsay. Thanks for having me. So I'm a hospitalist at Johns Hopkins Medicine, and I work with the BESAFE group, which is working to help educate individuals about falsified and counterfeit medications and strategies to help avoid that. BESAFE stands for Behavioral and Educational Strategies for Avoiding Falsified Medicine Exposure.
So why don't you start off by telling us what you mean by substandard and falsified medicines?
So substandard and falsified medicines could be those that have no active ingredient, too much active ingredient, or too little active ingredient, or it could be laced with a potentially illicit substance. Fentanyl has often been in the news, but it could be things like heavy metals like mercury or lead. And so basically it's an altered medication that is representing itself as being the legitimate one. And it can really be any kind of medication, generic, brand, over-the-counter, and any kind of category as well.
Where do people find these medications?
So first, I'd like to say that the U.S. supply chain is very safe. And what tends to happen, or where we tend to see these, is with this growth of online pharmacies, which I think individuals know about. They're widely available online. They look very legitimate. They tend to be foreign and non-regulated, and not go through the same strict processes that those within the supply chain do, with the subsidiaries and the pharmacy stores that are inspected, regulated, and those sorts of things. So the biggest source is individuals looking to achieve a cost savings, and non-reputable online pharmacies are really widespread, and that seems to be the major source.
How might someone know if a pharmacy is reputable or not?
Great question. So the National Association of Board of Pharmacies actually has a website. They've looked at this, and you can search for the online pharmacy through there to see whether it is accredited and whether it is legitimate. The other key things to know is that any online pharmacy will require a prescription from a provider. If they're giving you the medication without a prescription, that's a red flag. You could always verify through their websites, but websites tend to change. And so we really defer more to these national professional associations and this list.
In this conversation, we're going to mostly talk about the U.S., but can you speak a little to the global prevalence of this?
Yeah. So according to the World Health Organization, about 10% of medications worldwide fall into this category. It tends to be broad spread, both in developing as well as developed countries, and crosses all the different categories. Basically, if there's a demand for it, someone is probably producing it.
And so you mentioned BESAFE before. This is you and a team of researchers that have partnered with Pfizer. Tell us a little bit more about that project.
Yeah, so I think this is an important partnership because a lot of these individual pharmaceutical companies are really working for safety and quality, right? If there's a counterfeit product out there, it really affects their reputation. But we take that a step further. We're not looking or working with a particular pharmaceutical company or category of drugs, but we're applying public health concepts, talking to clinicians, and really helping to translate the work that the pharmaceutical companies are working on the back end into more of a public health campaign and a safety and quality broad campaign. So right now, Pfizer is one of the leaders in this area, and they serve as a consultant and help to financially support our work. And we're reaching out to other pharmaceutical leaders. And again, we know that each of them has their own individual safety and quality departments. They work with regulators and enforcement, but this is taking a bigger step forward.
You mentioned that this goes across all categories of drugs. And one thing I've heard about is, for example, cancer drugs are really expensive. And people may be going to these online pharmacies. Maybe they don't have health insurance. Maybe whatever drug they're looking for is not covered by their insurance. Is price part of the incentive for falsification of drugs? Because people can't afford it, so they're going to other spaces to find it.
So that's a complicated question. A lot of these infusions and biologics and other things are also very expensive. But it's a complicated question because the price is driven by shortages. It can also be driven by supply chain issues. And so it's kind of up or down. But if there's a demand, someone will probably be producing it falsely. And one of the interesting things that we found is when we spoke to oncology pharmacists, oncology nurses, and oncology physicians, and we asked them about this issue, about the safety, in the US supply chain for these medications. And they actually told us, we get the medications directly from the pharmaceutical companies. These are expensive, but there are a lot of patient assistance programs that are available through the pharmacies, through the pharmaceutical companies. And so they directly apply, even for individuals with insurance or without insurance, through them. So the drugs that are actually being delivered directly to the hospital from the source themselves. The other interesting thing they pointed out is these medications also have expiration dates, right? And you can imagine that the hospitals won't necessarily have a whole supply of particular drugs because they could expire and then they would have to, unfortunately, waste these valuable medications. And so there are intermediary suppliers or holders that they can go through. And these are subject to the regulations and enforcement to protect safety of patients. So we have protections in place. There are some mechanisms like these patient assistance programs to help directly work with the pharmaceutical companies. And I think it's very important because this is a vulnerable patient population. Patients with cancer have adverse side effects. They may not do so well. Is it from the medication? Is it from the cancer? And so we really work hard to ensure that the medications are safe and effective in being given.
Where do you see big demand elsewhere, where people might be not able to afford their medications and so they're looking to these online pharmacies? What other kinds of drugs?
So you can't really watch a news program without seeing these GLP-1 agonists. So that's one of the biggest areas of concern too now about the medications being compounded and are they really the active ingredient and the corrective ingredient. So I think that's one of the major areas. In developing countries, a lot of the antibiotics, antimalarials, infection drugs, HIV drugs, those too are subject to being counterfeit or falsified. So it really just depends. But basically, wherever there is a demand, someone is producing it. And so we already know that there's a lot of focus on the supply, a lot of focus on the regulation. But what we're trying to do is educate individuals, develop strategies so that we can help on the demand side of the equation. Because if there's no demand, we know that there'll probably be no supply.
Where are these medications coming from? Who's making these falsified medications?
So that's an interesting question as well. It's from all over, as you can imagine. So online pharmacies we've already talked about as being a major source of this. There are also things like the dark web, illegally purchasing these substances behind the scenes. There's social media. There are also foreign countries which have less regulations and are making these medications which are more subject to being falsified or substandard, and then they end up coming into our supply chain or available through online. The other thing is to remember that the pharmaceutical process is complex. So some of the US legitimate companies may have subsidiaries abroad who are producing the medications for them, but not subject to the regulations themselves. And then, of course, there are things like informal markets, which we talked about, like social media or things behind the scenes. So all over, but definitely online pharmacies, non-accredited, non-legitimate, are the definite largest source of this.
What are some of the consequences of taking these drugs?
Yeah, so in the news, we've talked about fentanyl, right? Fentanyl-laced drugs. We've heard about people acquiring medications on social media or through other means. There are other things like heavy metals. You may have adverse consequences, nausea, vomiting. It could be toxicity, or the biggest thing is you're not really treating what you think you're treating. And so you may assume that you have been treated for something, but it really hasn't been there. And so, as I had mentioned before, we have seen that there have been 60 million pills laced with fentanyl, which translated to 380 million lethal doses. And so it's very important to make sure that we're getting true medications from legitimate suppliers.
Can you tell us what you've learned about the patient experience of this? Like when they go and they order something online, do they know what to look for?
We're educating not only patients themselves, but providers. And so our educational campaigns have strategized both for patients as well as providers in identifying them. There are simple things that you can look for. Things like misspellings, the medication doesn't look like it should look. It could be crumbly, the substance, there could be blebbing in the packaging as well. So these are all indicators, but really with the growth of the online world and ease of access and direct to advertising, that they really may not necessarily look for these things. So it's important to pay attention to these. And when we look at the physicians and the healthcare providers, we surveyed over 300 within the United States, and over 80% said that they didn't think that this was a serious issue. Less than 4% counseled their patients about it, and about 9 in 10 don't even know how to report if they suspect that a medication that their patient is taking isn't substandard or falsified. And there's also a provider level here, because when the visit is done, the medication is prescribed, and it's just assumed that the individual is taking it or they're getting it from a legitimate pharmacy. So it's important not to only address the issue of supply at the patient side and education, but also to educate the healthcare workforce. And so I think that's where BESAFE is very critical. It combines the public health campaigns and professionals with the medical professionals, with the pharmaceutical companies. And our symposium is very well represented with regulators, law enforcement, and other individuals who also work on the regulatory side and enforcement side.
So this is a problem around the world. What are some of the tactics to keep tabs on these fake medications?
So there's the educational level that we talked about at the providers and keeping patients informed, but there's also a big focus on technology. So with American Money, where we have microprinting, color strands, these other things, they're also being applied to the packaging. So they're being identified in lot numbers. And then there are more technical ones like assigned serial numbers, which can then be checked or verified or retired to avoid, for example, a product or product packaging being reused from legitimate medications to those that are substandard and falsified. So really, technology is also helping us to be involved. And believe it or not, some of these pharmaceutical companies have portable kits that they can go and test for the active ingredient. So if they suspect that their product is not being used appropriately or counterfeit in a particular area, they can then go to those areas and locally test the medication itself to see if it's true and verified. So really, technology has evolved as part of this as well. And so we're looking at all kinds of enforcement strategies as well as educational strategies.
Are there ways for providers and patients to report if they think they have a counterfeit medication?
Yeah, they can report either through a law enforcement or through the FDA. So the FDA also monitors for adverse events. They do post-marketing as well. In developing countries, they have ministries of health where it tends to get reported, or they have specific agencies. In some of these countries, they even have an app to report it. So that tells you how prevalent it is. If you can build an app for it, there's probably a reason why. So it really is widespread, but that's part of our educational campaign as well as where or who to report it. And we also, like I had mentioned when we had surveyed the oncological professionals, whether they be nurses, pharmacists, or physicians, the role tended to be deferred to the pharmacist. It was that the pharmacist would most likely be the individual who would be quicker to recognize that the medication was substandard or falsified. And so that's where a lot of these strategies lie too, at the pharmacy side.
In your work with BESAFE, what's one thing you want people to understand about your work or to understand about this world of counterfeit drugs?
I think the biggest point to be educated here is that if there's an issue with cost, to be very upfront with your healthcare provider and to discuss it. If you're planning to go a different route, discuss it with your healthcare provider, but really to use legitimate and verified sources for medications. We know that we all tend to try to shop around to get the best price, but we also need to know what we're actually buying and who we're buying it from. So I think if you're going to use an online pharmacy, it should be one that's regulated and a subsidiary of one that is regulated. If you're going to go outside the supply chain, I can tell you, even for our oncological providers, that they don't accept outside medications. There have been cases where patients want to bring outside oncological medications, and the providers are not comfortable with that because they can't verify the authenticity. So it's buyers beware, but it's also being transparent and discussing things with your healthcare provider.
Dr. Henry Michtalik, thank you so much for joining us on Public Health on Call.
Thanks so much.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.